I will hope and pray that this is truly a breakthrough.
We can fly to Australia.
You're not giving up yet. The news about your cancer drug is like a beacon of hope.
She's scared. She does not want to die.
1 in 5 people will suffer from cancer in their lifetime. Many will not survive it. For most cancer patients, the only hope they have is chemotherapy. Chemotherapy delivers toxic chemicals to the body randomly, affecting not only the cancer cells, but also healthy cells. The holy grail of cancer research is to find a solution to the dangerous side effects of chemotherapy. Scientists Himanshu Brumbutt and Jennifer McDiarmid are about to realise their dream as they begin clinical trials on a discovery their peers are claiming will be the magic bullet many have been searching for.
It was absolutely fantastic.
However, for their small Australian biotech, there are many pitfalls. The cost of taking a biotech discovery to market can be $1 billion. The process is complex, and only about 8% make it. Even in the face of desperate need in cancer patients, will this small Australian David be able to take on the international biotech Goliath? 20 years ago, these two molecular biologists met at night for weeks on end to discuss ideas.
So target your cancer cell.
A colleague had just died of horrifying cancer, and his dying words challenged the pair to find a solution to the growing problem of cancer.
As long as we can get a linker.
Jennifer and I were at the hospital, and he said, if someone can do it, you can do it. He pointed his finger like this to us. You can do it. I just can't forget his eyes when he said, it's alive. It's just the impact of that. It's just so horrific. And I thought, a stupid man, what have I done with my life?
So strongly motivated by the needs of cancer patients and believing they had a revolutionary idea, they risked everything and set up their own laboratory, which they called Ingenic. This small biotech company, with its dedicated staff, has produced compelling evidence at lightning speed to verify its discovery.
Imagine I have like 100 mice per experiment, and then it went on to a trial with the monkeys, and then we went to dog trials, and now if we go to a human trial, imagine from a mouse to a human within the span of 7 years. So to me that is very exciting.
Scottish-born immunologist and former Australian of the Year, Ian Fraser has experienced firsthand the process of commercialising science. He created the vaccine Gardasil for cervical cancer.
There's always a risk that a good invention will not make it to market. The good science may not easily lend itself to getting out into the marketplace. People may not understand the need for it yet, or the potential may not be there.
In the next month, the Ingenic Dream Vector, or EDV, will be injected into a human for the first time as the trial process begins. Never before has a bacterial nanocell been used to carry chemotherapy into the human body.
The pressure is really mounting. Obviously, we've got to get it into people, but it's very scary. Nothing like this has been given to people. It's not a Me Too drug. That's what's keeping me up at night.
Cancer drugs cause horrendous toxicity. So it's somehow, if you're going to put a drug inside the body, if you could encapsulate it and make sure that it doesn't go into normal cells, then you need something to pack it. Then you also needed something that's going to prevent that ball from going into normal cells. So therefore, you needed something on its surface that's going to lock in a cancer cell and not lock into a normal cell. But the more I looked at it under the microscope, the more you felt that this was not just any ordinary particle. This was something quite remarkable. It had a complete structure, membrane structure. It was non-living. It had a capacity inside. It was empty. It's like a house. You could live in there. Something could go in there. It had structures on its surface, hair-like structures. These are very important structures because to that you could attach other molecules. And those molecules can then target something else. And suddenly you could see that whole picture unfold.
And GENIC have published their work recently in Nature Biotechnology, which is the prestigious journal in the field. What that really means is that it has been rigorously peer-reviewed by a group of other scientists who work in that space, and they've said, A, this is novel, B, it looks like it works, C, it's really of interest, because to get into one of the Nature Group journals, it's got to be top stuff. And what that really says is they've got a winner.
A team of Sydney scientists has worked out a way to kill cancer tumours that have...
This Trojan horse might just open the gates on a new cancer treatment.
Drugs were once considered to be the magic bullet. Now it's the vehicle by which they're given to the patient, taking centre stage.
The international biotech industry is ruthless and cutthroat, and taking science to market is not for the faint-hearted.
So it's a bit worrying.
The figure that's widely quoted as the cost for taking a new discovery from the lab right the way through to a product in the marketplace is about $1 billion US. A large part of that money is spent in the final studies that will show that the drug works, but the money is spent over a very long period of time, usually 10 to 15 years. So quite a substantial part of that money is invested 15 years before there's any prospect of there being a return on it.
Venture capitalist Stuart Wardman-Brown is just such a risk taker. His company has invested in Ingenic for 8 years, and he is currently acting as chairman of the board.
For me, Ingenic is very clearly a business first and crusading against cancer second. For other people, I can understand that perhaps it's a crusade against cancer, and that the business aspects are merely one of the things they've had to do in order to raise enough funds to be able to take that crusade, hopefully all the way through, and have an impact on cancer.
Clearly, positive trial results will increase the value of his shares, and he wants the science to move quickly.
But not as good. Yeah. She is tough. It may have something to do with that Scottish background. They go out there in that vicious cold and they will fight to death. These are valiant fighters.
He has been able to harness a thought process that is almost foreign to me. You know, he can see the big picture very clearly and develop a thought process which is very exciting to be around.
To prepare for the huge step into human trials, Ingenic has done extensive testing in animals.
27 dogs. Nobody goes into a human trial having studied so many dogs. But we have had to go through all of this because we needed to know for ourselves that was there something that we have missed. Something that, again, our conscious mind might have said, everything will be fine. So irrational exuberance is what we have to try to avoid.
However, their successful treatment of dogs is undeniable.
We've got a brain cancer dog that jumps up, grabs the biscuit and, runs around, etc. And when I look at the dog and I feel that this little nanocell went in there and did all those things, I still look at it in absolute amazement. And the dog just stares back at me. and says, have you got a biscuit?
Dogs get cancer just like humans do. And these cancers need to be treated just like they would be in a human, and they behave very much like they do in a human. So trials that show that a drug works in an animal model where the cancer is a real and spontaneous one are much more likely to be representative of what would happen in a human.
Matilda, come and have a look at your brain scan. And this is the brain tumour she had, clearly inoperable because it's right in the middle of the brain. So here we have where the brain tumour used to be. This is following 5 doses of EDVs loaded with doxorubicin and targeted with EGFR. The bottom panel shows that the tumour is basically totally resolved in Matilda after only 5 weeks of EDV treatment.
To have Matilda come in, and it's quite a surprise really, you sort of all of a sudden go, wow, this is actually making a difference. You know, we've cured a dog, and surely the next step is to cure people.
We've got pressure from the investors. When's it starting, when's it starting, when's it starting? And we're saying, well, you know, a week either way to make sure it's right is not going to make a difference.
The clinical trials are being conducted in Melbourne across 3 hospitals. Before this can happen, a totally new piece of science like the EDV is extensively scrutinised by clinical and ethical committees. Finally, the EDV is cleared for first-in-world human trials.
This is it. This is the final lyophilized EDV preparation that we'll be sending down to Melbourne for the human trial.
Most clinician scientists feel very nervous when they go first into a clinical trial. It's called first into humans, because you just don't know what's going to happen. You've done all the right homework, you've done everything you possibly can to make sure the product's safe. You're usually convinced because of the nature of the product that there shouldn't be any problems. But having actually put a drug into humans for the first time myself on more than one occasion now, yes, you get very nervous about that and you take every precaution.
And certainly Jennifer and myself are full of fear at the moment. We feel, is everything going to be all right? What happens if something goes wrong, somebody gets a reaction? Such a system has never been trialed before on this planet.
There's plenty to be anxious about as the science moves from the laboratory to the hospital in preparation for the trial. Not only do the medical costs soar, but the scientists now have to hand over their precious discovery to the clinicians who carry out the trial. Professor Mark Rosenthal is on the trials team.
We were excited 3 years ago, I think, when I first met with Jennifer and Himanshu. I suppose we're relatively sanguine about the chances that this really will be a success.
It is quite difficult in a way to be an onlooker in your own trial. But we're not that down there holding hands with the patient, which frankly is what I'd like to be doing, you know, saying, are you all right, you know, feeling the pulse.
I believe the scientists have to stay well away from the entire program. They've done their bit. They've made the discovery. They've done the development. It's now up to the clinicians. And I think it's utterly inappropriate for there to be any link between the scientists and the clinicians in terms of interpretation of data. What our public, what our patients want is clear-sighted analysis of what this all means.
But the whole focus of the scientists' research is to help patients. And after nearly 10 years of painstaking research, our team finds it impossible to be too far away from their first patient.
I've been thinking about that woman all the way down, really, and how brave she is. I reckon you'd see, if there was any problems, you'd see it by 4 o'clock.
By 4 o'clock, I would have thought, yes.
Yeah. You're always battling dogma and preconceived ideas about how cancer therapy should be controlled. It's a battle all the way to get them to change something, even though it's a clinical trial.
It has taken 10 years to begin first-in-human trials, and today is the culmination of many years' work, and everybody is tense. The Engenic team is delivering the first dose, and Jennifer and Himanshu want to be very close in case anything goes wrong. They've taken a hotel room right next door to the hospital. They're hopeful the clinicians might relent and give them access to, or at least information about, the patient. For now, there is nothing left to do but wait.
It's been the longest 5 hours of my life.
A chance call from the trial pharmacist John Barlow finally brings the news everyone's been waiting for.
He was just over there, just happened to be moseying past the...
Yeah, how convenient.
Picking up something for another trial, he said, yes, right. But he had a long chat with her.
Oh, yeah, nice.
She's a very charming woman who's very chuffed at being the first person on the trial. And she said she didn't feel a thing, still doesn't feel a thing, nothing's happening. She's just laying around reading, waiting to go home.
By the end of the day, it's time to get back to Sydney. The team knows the beginning of the trial has been a success, and the first patient has received EDVs without any side effects. Something really big has begun in Melbourne. Ingenic now needs a big pharma to invest. Human testing usually runs over 3 trials, each bigger and much more expensive than the last. But even though they are now testing successfully in animals and humans, in order to attract a big pharma,
What have we got?
they will have to take a backward step and produce a test tube result.
What sort of cells?
In the pharmaceutical industry, this is the conventional way to prove that the science is robust.
Yeah, can I have a look at cells only?
Yeah, that's cells only.
And these are lung cancer nasty cells. I'd wake up sometimes early in the morning and I could imagine what I would like to see under that microscope. These are the HCT cells, is that right? Okay. Every cell specifically being hit, and I could always imagine there's going to be all these dots. But failure after failure after failure in experimentation. For 5 months we failed.
It was absolutely fantastic. This is...
Yeah, let me have a look.
This is fantastic. Every cell.
Oh, yeah, this is really good.
This is really exciting because today we've been able to show the EDV locking on to the cell, the cancer cells specifically, in great numbers and ready to be engulfed and cause death to the cells.
Even though the first experiment is successful, there's now urgency to repeat it so that pharmaceutical companies are convinced it can be done in any lab. It's a stressful time for everyone in the company.
The amount of funds required to run this kind of an operation is absolutely massive. And investor funds cannot keep on supporting this kind of effort. So we need to partner with a major pharmaceutical company, one or more, such that in that partnership, the big pharmaceutical company has sufficient financial muscle to be able to support, not only support this research, but develop it quickly to get it into the clinical trials and onto the market, if they are successful. But without that partnership, this company could be in extreme danger because we already are aware that there are certain hawks out there whose intent it is that if we run out of money, they will swallow us whole.
Jennifer and Himanshu have become aware that some of these hawks are within the ranks of their own investors. At this point, some investors believe that the scientists should be replaced as managers of the company.
The science is first rate, but you've got really almost a fundamental divergence of the commercial imperatives of the investors who want to see this commercialised and the scientists who want to see the science progressed in accordance with their own view. The model with the scientists who've got no commercial experience running the commercial development is not often a model for success.
The difficulty is the scientists have to understand the businessman's point of view, and the business person's got to understand the scientist's point of view, otherwise it doesn't work. Most small biotech companies that get into trouble early on get into trouble either because they don't recognise they need both bits of the equation to make it work and try and do it on their own, either a businessman trying to run the science or a scientist trying to run the business.
Despite opposition in some quarters to their management, Himanshu and Jennifer survived the challenge to their leadership. They put their case for further funding to their principal investor. Meanwhile, the human trial in Melbourne is progressing very positively. While the scientists remain at arm's length, because the science is so new, the clinicians need the scientists to understand the novel technology.
Good work. Yes.
Good.
Cheers.
Right from the beginning, our patent attorney said to us, if this turns out to be as good as what it sounds on paper, you are going to end up in court somewhere in the future.
As a consequence of the Nature Biotech article, it becomes obvious that an American copycatter is trying to register an aggressive patent. Himanshu has to counter its claims.
The whole business of patenting itself is a very complex one, and getting it right and protecting things will take away a lot of energy from getting on with new science, because you've got to get the wording right. That's what patent attorneys are there to do. But you've also got to make sure that you've thought through all the possibilities. Supposing somebody did it slightly differently, would they be able to get round your patent and leave you in a situation where you had a patent but it wasn't actually protecting the thing that you needed to protect? So I think there's a whole industry growing up around the idea of how can we make money out of patents rather than how can we make money out of products.
When you're dealing with situations where people are dying and there are these sorts of scavengers of society sitting out there smelling money, and they go after you on fraudulent grounds, it makes your blood curdle.
After a long night of answering challenges from Patent Office examiners, Himanshu still can't get back into the lab.
God knows who makes these people as examiners in these patent offices, and they can virtually destroy your entire company because on false grounds they keep on arguing with you. They keep on arguing and say that, no, this is all obvious, you don't have an invention. And they always think everything is invented in the United States. Nobody else has invented anything. It is how can I stop you from getting there? Strangely, such people never seem to get cancer.
In the heat of this copycatting threat, the need to keep proving the science takes on an urgency and keeps everybody working around the clock.
What we're seeing here is the EDVs still on the outside, but as they take up the EDVs, the cells aren't able to keep doubling, so eventually they'll die, which is exactly what we're after.
Let's leave it till morning.
In the worst case, we'll see cell death.
We'll see cell death, yeah.
Yeah, if we see cell death, we'll all be happy. Okay. There are so many emails that have come in about children dying from brain cancer. And you think, there is no room for resting until we get this out there for such people.
Chairman Wardman Brown arrives for a board meeting in time to see the overnight results.
Look at this one. Even the uninitiated, no offence, Stuart, can see that...
I qualify perfectly for that.
Can see that there's a big difference.
Yeah. That is fantastic.
Yeah.
Well done.
Yeah, they sure are dead. Thank God for that.
It's fantastic, and that's what now we can be absolutely confident that in anyone's hands, if you give these EDVs with the siRNAs, it'll work.
The differences between scientific and financial concerns are set to divide the board. Tensions are mounting again over who should run the company.
Unless we get proactive.
Jesus Christ.
Come on,
get proactive.
Pretty proactive.
Yeah, this company shouldn't fail. It's just stupid. So if we can find a way of it not failing...
We obviously need a solution by the end of the month.
A scientist generally is regarded as somebody to be put aside after a certain length of time. and that the real business is in the business development people and the clinical trials coordinator, etc. It's a worldwide phenomenon, and I don't understand it, frankly. It's just that money speaks, and money is important.
If we look back at why Jennifer and Himanshu have been so successful with this science, it is because they have been hands-on in terms of planning and executing experiments, and therefore hardly anything ever goes wrong. When it comes to a business, you can't run a business that way. You cannot have a two-man band achieving a very high valuation from a buyer, and so therefore they are going to have to learn to delegate and learn to let go a little bit in areas where they would probably feel more comfortable if they were, far more hands-on still.
You can't just say, OK, science is finished, commerce is in now, you guys just go and make sure our patents are OK. It's not going to work.
Would we lose freedom to operate? If we were successful in human trials and then unsuccessful from a personal view, from an investment perspective, but also from getting a product to market, it would be a tragedy. And so that is my biggest fear, because arguably it is within our control.
We have dosed 8 people, I think, with over 70 doses. And we've shown that a biological like this, derived from bacteria, is not going to cause any ill effects in people at the levels we're dosing. And probably at therapeutic levels, it's going to be safer than any chemotherapeutic that people get now.
Whilst the downside of publishing leaves one vulnerable to copycatting, the upside for Jennifer and Himanshu has been the arrival of a nuclear scientist, Professor Dale Bailey. He read of their work in Nature Biotechnology and believed that he had an imaging process that could follow the EDV's passage through the body and into the brain.
Here it comes. 15 seconds.
Today, the team of nuclear scientists and vets are combining with the Ingenic team in a world-first experiment to prove the EDV can target a tumour in the brain.
Images we're looking at on the screen here are the first dog that we've studied with this technique. And what we're trying to do is to see where the mini cells are actually going in the body. And so you can see in this combined image that we've got the tumour seen in the MRI scan, but that's exactly where the mini cells are targeting. So when this signal you can see here stands out at you and you suddenly see that you've actually got the mini cells in the target, it's a very exciting time.
The EDV has done the impossible and clearly entered the brain tumour.
The results are staggering in many ways, but they are also what we expected to see because of the strengths of the Ingenic delivery vehicle.
Armed with successful trial results and a breakthrough brain experiment, the scientists now change gear to continue the pursuit of a pharmaceutical partner in America.
Taxi!
Downtown Manhattan is a long way from the lab. The next days are stacked full of meetings with venture capitalists, big pharma, clinicians, and finally an important scientific ally. In another world on Long Island, Bruce Stillman is president of Cold Spring Harbor, one of the most prestigious laboratories in the world.
I went over, this was soon after the company started, and talked to Jennifer Himanshu, and they explained some of their ideas. And I was very excited about the whole concept of what they were trying to do and particularly the novelty of it.
As co-author of Ingenic's publications in biotechnology, Stillman is very aware of scientific competition and its implications.
Science moves very rapidly, and a competing technology could come along overnight. And there's no guarantee that this will actually end up being an approved clinical product, even at this stage. You do clinical trials in very advanced cancer patients, and to try a new drug technology in patients that have effectively failed all current cancer treatments is not a good way to test whether your drug's going to work. But then you go and talk to the oncologists and the people treating these patients, and they say, well, you know, we ethically can't not treat them with, quote, the standard of care, even though the standard of care may not work and has been clinically shown not to work.
Unfit patients for their clinical trials, threats to their leadership, and the ever-present battle for funding makes commercialising science an uphill battle all the way.
That guy yesterday said it. I'm the emperor and you're the gladiators, and I do that or that.
Yeah, that's
Oh, okay, good way to start a meeting. Thanks a lot.
On Wall Street, Jennifer and Himanshu are joined by Chairman Wardman Brown to pitch to venture capitalists.
You have a process here that I don't know that anyone's really thought about. But very clever.
Yeah. Yes.
So the expectation is that this could be for the current investors, the final round of investing?
I'm confident that they'd be very interested.
At this point, Ingenic has to find either a pharmaceutical or a financial partner with enough funds to invest in the huge cost of the next trials. In the biotech industry, even though big advances have been made in China and India, all roads still lead to America. Tomorrow, Stuart is off to pursue venture capitalists in San Francisco, while Jennifer and Himanshu fly to Indianapolis to meet with a leading pharmaceutical company. Eli Lilly's Chief Medical Officer, Tim Garnett, plays a critical role in selecting partnerships for the company.
I think one of the challenges that face the industry at the moment is that drug development is taking longer, it's costing more money, and the threshold for getting drugs approved is getting higher and higher. I think increasingly big pharma companies are looking to small biotech as partners in the drug development process. Forming an alliance with a company at an early stage is a much more speculative investment, but obviously a much cheaper investment from the pharmaceutical perspective. Once a drug is in phase 3, there's a pretty high chance that it's going to be successful and that it's going to get approved. So licensing a drug from a partner at that stage of development can be a tremendously expensive undertaking. And of course, once a drug has already got approval by a regulatory authority, then we're talking about deals that can be hundreds of millions or even billions of dollars.
With such money at stake for pharmaceutical companies, secrecy is paramount, and the scientists meet behind closed doors.
That was really, really good. I reckon that's one of the best sessions we've had.
Yeah.
Don't you?
I think it was fantastic.
And I think it's because we're into humans, but also they talk about unmet needs. They've got a whole bunch of things happening that they need resolution to.
The next stop for Jennifer and Himanshu is Washington to meet with their patent attorney, Stephen Bent. They're preparing for a meeting with the FDA.
Run it right through again. I mean, to some extent, it's a race to the patent office, I suppose. Many patent systems in the world are, in fact, first-to-file systems, meaning that the person who gets the application that's effective, a good application on file, will be the patentee.
The American Federal Drug Authority is one of the most rigorous drug regulators in the world. Jennifer and Himanshu have been answering their examiners for many months.
I came to like them very much because they had a certain integrity, I guess. They were by far more concerned about the humanitarian aspect of it because they wanted to get this technology up and running so they could save lives. So they were brilliant people with good souls, and that's not all that common in my business.
Today is their first opportunity to meet the examiner face-to-face. Without FDA approval, the EDV cannot proceed.
When they go to a pharmaceutical presentation and are able to speak about what they know best, which is the science and the potential of this technology, there's nobody any better than they.
That's why the people who are often the best determinants of what will actually work are the people who came up with the invention. They know their own science better than anybody else. They will be the best salesperson for it.
After a positive initial meeting with the FDA, Jennifer and Himanshu now focus on a potential clinical trial in Baltimore. Johns Hopkins is arguably one of the best trial venues in the world, and their association with Ingenic will impress both US farmers and the FDA. Long-distance discussions have already begun about the possibility of a brain trial using the EDVs.
We have a very large neuro-oncology center here, and all we do are brain tumors. In a year, we do between 800 and 900 craniotomies, so brain tumor operations for tumors, and that's all comers. The system is set up so that we treat a very large number of patients with brain tumors, and as a consequence to that, it's relatively straightforward for us to test therapeutics in a very systematic and rigorous scientific fashion to figure out if they're beneficial for patient care.
This is the first time we are actually able to do live imaging in such a large animal to detect mini cells in the tumor tissue.
The potential of actually delivering radioactivity to a brain tumour, not to anywhere else, but is there with this.
Now you can see where the blood-brain barrier is intact. There's no sign of mini cells at all. The white mass is where the tumor is, and right in the middle of it you can see the mini cells light up.
Neurosurgeon Gary Galea is keen to introduce the Hopkins superstars, leading brain authority Henry Brem and the trial supremo Skip Grossman.
1984, when I came to Hopkins, there was a 20-year period of no drug being approved by and it's a generation, it's a lifetime that the FDA had not approved anything. Now, when you speak to the FDA, it's because nothing was presented to them in a fashion that they could approve it because there was no data that met the criterion.
We have a 15 different brain tumor centers around the country that are all on board for us doing phase 1, phase 2 trials. We've opened over 60 trials.
The realization that we can actually move forward in a clinical trial arena is very, very exciting for me. I think their technology is very novel, is scientifically very solid, and I think has a very high chance of working.
Our view was that it would be a focused group here at Hopkins.
When I see a patient in the office and I know that I have to have a discussion with them that despite maximal therapy at this point in time with surgery and chemotherapy and radiation therapy, that the median survival is just over a year for them, I think the opportunity to actually test something that may change that for future generations is very stimulating for me, and I look forward to this collaboration.
Every meeting has been successful from our point of view.
There is nothing that beats face-to-face communication.
And Johns Hopkins meeting was spectacular. I think we learnt a lot as well.
The Johns Hopkins team is clearly interested in trialling the EDV for the brain. However, Ingenic has to fund the trial at a minimum cost of $5 million, and it can't proceed without regulatory permission from the FDA.
As soon as they touch down in Sydney, they meet Stuart to present the results of their trip to the board. Although meetings in America have been positive, no US pharmaceutical company has yet stepped up to the plate.
We quite simply cannot start the brain cancer trial without sufficient funds. So we can't start that trial without raising 15 million rather than 5 million.
However, with financial stress on all fronts, the board is forced to raise interim funds to keep the company afloat.
We've been directing our efforts more towards Asia, and we are making reasonable progress, but it's slow progress. And every month that goes by for Ingenic uses up roughly another $500,000. Yeah, it's pretty tough at the moment. Absolutely. We will run out of cash in probably 2 months' time. What we as a board then have to do is to really focus the resources on what we must achieve in the next 9 months to give ourselves the best possible chance of getting a partner across the line.
After much debate, the board decides that their best option is to raise $5 of the $15 million with a new share issue to their original investors.
In blue are people who like us. So far I've only found 2.
I'm finding it very stressful at the moment because we are back in fundraising mode. The deals that we're working on, as usual, won't overlap when we run out of money. So we've got to find some funds, at least for the interim period.
Emotionally, it is very draining because we don't have the resources. We're just about 30 people. And we're constantly being asked, why haven't you commercialized everything? Why haven't you made your $1 billion? What $1 billion?
There's nothing really that we ever disagree on as far as strategy or way to proceed or who to talk to. Right now we'd talk to Attila the Hun if he came in with some money, so...
In the middle of all this, Stephen Bent, the company's patent attorney, arrives from the US with another set of concerns.
Everything is converging on a point. Nobody's pulling in one direction. And for a small Australian company to have to pull that weight is asking an awful lot. That's why I'm trying to tell you that what's happening right now with Ingenic is absolutely critical, because it's at this point where IP stuff and regulatory stuff goes, the wheels come off in many companies and they go belly up.
If we were to lose the umbrella patent argument, would we lose freedom to operate in the US?
No. You're not doing anything that would infringe those claims. Right. Are there places where you can make errors? Yeah, just about every place, actually. And that's part of the problem and part of the challenge, that they have to really make all the decisions correctly, because unfortunately, at this point in the game, wrong decisions could be fatal. You're working with the right group. You're getting federal support so that you're not taking on that that risk in toto. These are the things that can make or break a company. For Himanshu and Jennifer, I think one of the things that has come home to them is that their science, which is top-notch, will not serve. It is not enough. It's not even half enough. The old saw, if you build a better mousetrap, the world will come to you. That's all baloney. That's not true. You don't need great science to succeed. You do need great management to succeed. You cannot make it without it. One will not carry the other.
Stephen Bent leaves 2 days later, wondering if his cautions have been heard. Unfortunately, there are other worries as well. The fundraising from the original investors has only brought in $3 of the $5 million they need for the Hopkins trial. It's only at the last minute their major investor, Champ Ventures, comes to the rescue.
And partly that's what I'm thinking. If we can catch up and say, we're in for two, we now need to wrap up this part of the round, because then we're going to go quiet for a while.
It does take a weight off our shoulders.
So it gives us a time to potentially bring in a pharma deal. And then hopefully after that, we won't have to do any further fundraising.
With $5 million in the bank, Jennifer and Himanshu return to the US to search for the additional funds they will need to start the brain trial. New York proves to be anything but bright lights. Biotech investment has completely stalled. A bleak economic forecast means Ingenic's potential deal partners have been unable to raise their own funds.
Yes, it does take a long time to get something up and running.
Although Jennifer and Himanshu work day and night, it seems night has fallen on US investment, particularly for offshore companies. In this market, only 0.4% of companies like Ingenic are making it to market, and many scientific innovations are being lost. Meanwhile, the World Health Organization confirms that cancer is the world's leading cause of death and predicts 22 million deaths to cancer between 2012 and 2030. This silent pandemic is set to overwhelm public health systems. Back at home base after an unsuccessful fundraising trip, Himanshu's health buckles, and he's ordered to take 2 weeks complete rest. Preparations for the second FDA meeting carry on without him.
How's Himanshu doing?
Yeah, he's good, thanks. He's coming good, feeling better. Do you think it's important to have Johns Hopkins represented there?
Yes.
The FDA are the gods of all things medicinal in the US, and you have to run the gauntlet there to put anything into a human.
Days later, Jennifer is back on a plane to the FDA meeting in Washington, with board member Bob Graham standing in for Himanshu. By the time they return, Himanshu is back on deck and anxiously awaits their report.
You can't have much better endorsement of what we're doing. Everyone we went to could see this technology had enormous power, and that we've already crossed the hurdles to show that it is a therapeutically feasible technology in humans. If we can show any hint of efficacy, whether that's target engagement or real efficacy, I think we're really home and hosed.
I do believe in Ingenic's potential. I still wouldn't be on the board. You can't help but feel disappointed about where we are. Clearly the expectation was that we would be further ahead in terms of commercial success.
Ingenic at the moment is in what is commonly called the biotech valley of death, which is depressing, and you have to get over the chasm, and it's starting to cost a lot.
There is an intensifying funding crisis, and critics are gathering.
There are a couple of ways to go. One is actually to seek to sell the company or to sell the IP to somebody pretty quickly to get it out there. The other is that the company will, regrettably, there is a prospect of some kind of administration if they can't get the money.
I've had sleepless nights, and I'm sure Himanshu has too, but we haven't got the luxury to be scared. And we've got enough people around the place dropping their decks, and saying, oh, we'll all be ruined. We can't afford it because we've got a lot of mouths to feed and we've got a bigger purpose.
So obviously there is the scenario we're trying to avoid, which is for the company to fall over. But then some snippet of the technology or a piece of data comes through and you think, oh, we've just got to find a way around this because it's every bit as exciting as it was 11 years ago. It's arguably more exciting because we've got more tangible data. It's no longer just a dream. We need to make sure it doesn't end up being a nightmare.
Frustrations run high as the scientists leave yet again for America.
It's a whistle-stop tour, that's for sure. We're going to San Francisco, where we've got a couple of meetings, Boston, New York.
This US trip finally yields a big fish.
I couldn't help being attracted to Ingenic when I met Jennifer and Himanshu. Their dedication, their devotion, their commitment, their energy comes burning through.
Merv Turner has been the licensing manager for Merck, one of the world's biggest pharmaceutical companies, for 30 years. He's come to Sydney because he likes this science.
And I really thought they had a tremendously novel and interesting idea. It really challenged a lot of the orthodoxies in our business, and that made it interesting to me.
Thank you.
And generally speaking, the big breakthroughs that you see come from unorthodox approaches.
To us, he is a heavy hitter who totally believes in the technology, and he has commercial savvy.
How frequently do you take the scans?
Every 6 weeks.
Every 6 weeks.
Good boy.
The Ingenic approach uses so-called bacterial mini-cells, small fragments of bacteria. It's generally assumed that administering bacterial fragments to patients is a bad idea. Those bacterial fragments, they're loading with drug. That is something that no one has attempted before or people thought possible before. So that flies in the face of conventional wisdom. They're assuming that those bacterial fragments loaded with drug can now be targeted to tumours. People have not done that before. Those particles would be considered by conventional wisdom too large to be transported across blood vessels to the site of the tumour.
He had the first
first seizures in December, just before Christmas.
So when you put all these uncertainties together, you can see the kind of cliff that they have to climb in order to gain the confidence of investors and gain the confidence of clinicians, gain the confidence of regulators in their ideas.
One of the areas in which I operate on is adrenal cancer, and it's one of the most lethal cancers known to man. Unfortunately for people who have this cancer, they're generally young. Last one, then let Charlie do it. The more I've worked with them and the more I've looked at what other people around the world have to offer in terms of nanoparticle delivery, we realise that they really are on something special.
Stan Sidhu's belief in the EDV delivers the team their biggest challenge yet, when he clears one of his patients for compassionate use. A young woman of 27, she has been told that she has 3 days to live.
We're hand making every single dose because no one's ever done this sort of thing before. It's exciting, sobering, and it's scary.
You can't help but get emotionally involved with the poor little thing lying there at, mid-20s with a whole life ahead of her and no life ahead of her at the same time.
We're building platforms, and then the next stage is to stabilise her, which we believe we've done, and then the next stage after that is to cure her.
This patient was 26 years of age, ovaries, uterus, everything resected. It was a pretty horrific situation.
Himanshu meets with Ian Fraser to discuss these remarkable results.
The patient was already in palliative care, on morphine, and the day when we actually came in with the first dose, we even had the priest standing there with the cross. We started and we cleared 13 weeks with clinically stable disease. We delivered 25 doses in 13 weeks in this patient. And most interestingly, the tumors were responding. Most of the metastases, they had stopped growing. This was the independent oncologist view. The patient's not being hurt at all. And the disease is in clinically stable condition.
I'm very impressed, I have to say. It's come a long way since I last spoke with you.
Only thing is the patient was very heavy on morphine and the addiction really got bad. At which stage the patient decided, I just don't want to do anything.
Had enough of it.
So therefore we lost it. You have a patient who is days away from death. That's where almost virtually all cancer patients eventually end up. And that's when we currently say that, no, hope you pass away in peace. No, we are not saying that anymore. We strongly now believe that to the last day, if there's a will to fight, there is a way to fight. And this fight can be successful.
Bye.